dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View.
Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about and actually teaching you compression-only CPR for sudden cardiac arrest. And with me today is Chris Stawacz, who's the Regional Director of AMR. And with him are two of his colleagues that he's going to introduce as we help you to learn about CPR and this particular method.
Well, thanks, Yvonne. Today, we're going to have our advanced EMT, Karen Scott, and Roger Chauvette, who's our paramedic, both AMR employees here in Nashua, give us a demonstration of how to do compression-only CPR. And Karen and Roger are well known in the community for going around and doing this on a regular basis, and they've trained literally hundreds of people in how to do this very easy technique.
Well, thank you very much for all that you do. And you had mentioned just previously before we started the show that AMR teaches this in 41 states.
We do. AMR is the largest ambulance provider in the country. We operate in 41 states, and this training is available in all of our operations for any of the public that would like to have it done. It's generally free of charge. We'll come out to your civic group or your Boy Scout troop or Girl Scout troop or whatever community group that you want to have and teach you how to do this.
How is this particular CPR, compression-only CPR, different than regular CPR?
That's a great question. For those of you who are a little bit older, like myself, in the old days, I call it, we would do mouth-to-mouth breathing for people who were in cardiac arrest. And through a variety of different studies, we found out, A, that was not actually even helping the person, and B, people were actually afraid to do CPR because of that mouth-to-mouth component. So clinically, just by doing compression only with your hands, you're providing the same type of care that you would have been in the past when we were doing mouth-to-mouth. And we found that we've been able to attract a lot more people that are willing to do CPR without that mouth-to-mouth component.
What's the difference between sudden cardiac arrest and a regular heart attack, and when you know when to do this versus anything else?
Well, a regular heart attack is oftentimes the heart does not stop. In fact, most of the time the heart does not stop. People experience symptoms of a heart attack, which is a blockage of an artery, typically by plaque. Those symptoms generally come on gradually over a period of hours. They include chest pain, jaw pain, sweating, difficulty breathing, and very important, those symptoms are oftentimes different in women. Women experience much different symptoms of a heart attack than men do. They don't typically have the crushing chest pain, if you will. They have a more subtle type of pain in their chest, or an arm pain, or a back pain between the shoulder blades, or nausea and vomiting, and that type of thing. So a heart attack, if you will, can lead to cardiac arrest, but cardiac arrest is when the heart actually stops beating. It stops perfusing blood. If you think of a heart beating like this,
yes,
oftentimes it's either stopped or it's beating chaotically so that there's not an effective pumping of blood going on.
So how could we check to know that someone's heart has stopped so that we know how to do this and when to do it?
If someone's heart is stopped, generally they are unconscious. They're on the ground,
okay,
or they're collapsed over in their chair, and they look ashen or purple. They're not breathing. They're clearly in distress.
Okay. And so what do we do?
Well, I'm going to leave that to Roger and Karen to
want to talk about
introduce.
This particular kit first?
Well, first things first, we're going to come up. First things you want to do is see. If you come across a person and they're lying there and they appear to be responsive, you want to get an idea.
Okay.
So one of the things that we do is you want to find out, are they sleeping, are they taking a nap, or is there something wrong? So we want to check the responsiveness. So what we do is we tap them on the shoulders. Sometimes we can give them a sternal rub. Out there, we always suggest as well that when you do that, you kind of stand to your side, because that way there, if the person was sleeping and you've aroused them and they hit you, you're prepared for it, okay? So we check to see if they're responsive.
By tapping on the shoulder?
Tapping on the shoulders.
Or right in here.
Yep.
It's
Give
kind of
them
a
little
rub.
stirrup rub.
Gentle rub.
You're trying to arouse them.
gradually
You're trying to make
awaken
them
them.
do
And you
something.
can talk to them, say, hey, sir, or ma'am, depending on who we have.
Right.
And if they do not respond, we strongly suggest, especially with an adult, that the first thing you do is you want to activate the emergency response system. You want to call 911, and if available, have someone go and get the AED machine, which we'll talk about in a minute.
Okay.
But you want to get that emergency call going because more than likely they need more advanced care. So you want to get the ambulances coming so that they can get them to the hospital and get that advanced care going.
So this is going on in between that advanced care arriving.
Yes. So once we've checked and they're not responsive, then what we want to see is if they're breathing.
Okay.
So what we do when we're checking to see if a person is breathing is lots of times what we'll do is we'll just rest one hand slightly on their chest,
Yes.
and we place one hand up over their mouth. You're going to be able to feel if they're breathing. You're going to feel the air, and you'll be able to see if they have chest rise.
Exactly.
Okay? If they're not breathing, then what we do is we immediately come in and we will start doing chest compressions.
Do we need to tilt the head at all or do anything with the body in order to get it ready to do this movement?
You want to make sure you're on a flat surface. So
Okay.
if the person is slumped over in a chair or wherever you might find them, you want to get them to a hard surface.
So would that mean the floor if that's
A
all
floor, if
that's there?
that's
So if
the
all
they're,
ground?
if they're on a
Yep.
bed, you want to take them off the bed, get them onto the floor if that's
Okay, so
possible.
you take them off the bed and
Yeah.
you put them on the floor.
Because as she's going to explain, what we're trying to do is compress the chest in. And if you're pushing against something soft, you're just moving the patient. You're not really compressing.
So let's say the person is in the bed and you're the only one with them. So you would probably go to the shoulder and gently move them and then slowly get them out?
Whatever is the easiest way. The thing, people lots of times they get nervous. They're like, well, I can't, if they're in the
Right.
bed and I can't get them out. The thing is that you're going to try to pull them out as carefully as possible,
Yeah.
but they need to get onto that hard surface because otherwise when you do the compressions, as he was saying, you're just pushing the body into the bed and you're not really getting that
benefit, that's what
compression,
you need.
which is what you need to have happen.
Okay.
Okay?
So, show
So
us.
what we do is once we have our hand here and we don't feel that they're breathing,
Okay.
what we do is we come up and we have a spot on the chest. And it's basically where you come up, where your ribs meet here at this point,
Yeah.
and you basically go a couple fingers above,
Okay.
and then you place the palm of your hand. 99% of the time, your middle finger is going to line up with the nipple line.
Does it matter if you're a righty or lefty and which
It
hand
does
you put down?
not. Either hand, whatever is
Whatever's-
most comfortable
right.
for you.
It's you. It's what's
Yes.
most comfortable for you.
So then you come up, you line up your hand, you grab on, and then you lock your elbows, have your shoulders. You try to get your shoulders so that it's right up above the sternum.
So you're going on your toes?
I'm on my toes,
Okay.
yes.
Which
and
is
then-
another show for later.
And then we do our compressions.
How
Okay.
many, how
We
quickly?
do 100 to 120 compressions per minute.
And so you keep going at it. It's like
You
each
keep
second.
going, yes. If your patient, it's 100 to 120 compressions per minute. You can sing the song everybody knows, Staying Alive
By the Bee Gees.
by the Bee Gees.
So let's see how you would do it.
Well,
How's your
we
singing
come
voice
up.
today?
No, we're not singing. So xiphoid process, we come up and we do our compression. So it's do, staying alive, and you just do that rhythm, and that will go. If by any chance you came up and you did the compressions, and your patient all of a sudden yells "ouch,"
Yeah, then you know they're
then
awake
they're
and ready
good.
to go.
We don't have to worry about
And
it.
then what do you do while you're still waiting for the emergency response team to come? What do you do with them then if they're aware and okay? Anything you need to do? Putting them back
For
on the
us,
table?
information
We would just,
gathering.
yeah.
What would you do?
Information gathering. So when we get there, we're going to be looking for a name, date of birth, allergies, any type of medications that this person's on.
Okay.
And a brief.
they have a history.
If they have a history, medical history, and basically a synopsis of what happened and how you found the person, and
Okay.
possibly time down, so we can start figuring out, piecing this picture together, so that when we present the person to the hospital, if they want to go to the hospital, we can paint the picture to the hospital.
So if it's our loved one before you arrive, and
Yep.
we have noticed, based upon what you're teaching us today,
Yep.
that they are not breathing and that the heart isn't going up and down, there's no movement, then we would take them off the bed if they were, take them off the couch if they were, and put them flat on the ground so it's
Yep.
a hard surface. And then we would begin the staying alive, staying alive, staying alive, and just keep doing that for
Yes.
how long? Until something happens?
Until either they become awake,
Okay.
or until
The emergency
we
team
arrive, or until you are too tired and you can't do it anymore.
All right,
And
then.
you have to understand that no one should ever feel guilty if they are doing CPR for an extended period of time and you just get too tired and you can't do it anymore. You've done the best that you can.
Okay.
That's what we're trying to teach by doing the hands only. We just want to give them the best chance. Here in the city of Nashua, we have a relatively very fast, quick response time.
Okay.
So we will be there within a couple minutes, and we will take over. But if you were out someplace and it was a distance to get there, a different community or out hiking someplace, you just want to do the best that you can.
It is physically challenging to continue to do.
imagine.
You'll see in a few minutes. But
Yeah, we could show you.
I'm going to do it, but I want to ask you one other thing so that
Yes.
our listeners understand this. So if, in fact, after we've done this, the person does, you feel the heart and they're breathing,
Yeah.
do we keep them down on the ground until you arrive, or what do we do to make them comfortable
I
while
would
we're
keep
waiting?
I would keep them lying on the ground.
Okay.
they
Don't give them
may-
any fluids, anything
No
to
fluids,
eat,
no,
nothing
because
to
lots of
drink,
times fluids, if you
no
give them
medications.
some, no fluids, no medications, because then they may vomit. That can cause a whole host of other complications. So we don't want that to happen. Plus, if they've had a chest pain and then that precipitated this event,
Yes.
we want to keep them as still and as rested as possible.
Okay, and if
We
they
don't want
happen to
them
be
moving.
chilly, it would be all right to cover
Oh,
them
yes,
with a blanket?
absolutely. Yep.
It's not that we have to keep them cold or
No,
anything
no.
of that sort.
Nope.
So shall I come to the...
Come
no,
on
go
over.
Okay, so if I listen to you correctly, you
Yes.
said to find this point
This
here,
fine point,
which is
yep.
really, is that right below the belly button almost?
It's above.
It's above
Yeah,
the belly
if
button,
you
because this
feel
doesn't
you
have a
and
belly
you
button.
come up where
yeah,
your
his belly
ribs
button's
are.
right here.
Oh, that's his belly
Yes,
button.
yeah.
Okay,
Yep.
forgive me. I thought there was a dent in the thing.
No, if you feel where your ribs are
Right
and you
here.
follow them up,
Right there.
you get to this point.
Yep, and then
which
I
is
go-
that your point. And then
then
it's
two
two
fingers.
fingers, hand
And then
above.
Hand above.
Yep. And then you can grab on, and you can use either hand. Some people go this way, some are this way, and some people even go this way. It's
Oh.
whatever is most comfortable for you.
So you kind of try and
Find
practice
your-
it until you do it.
yes,
And
okay.
so it's
And then you want to lock those elbows
lock the
as
elbows.
best as possible because we are a little shorter.
Yep, I'm on my tippy toes.
Okay,
like
there you go. And then you're going to push in and you do your compression. So
Do,
one,
do, do, staying alive, staying alive. Do, 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 staying alive, staying alive.
Excellent.
Do,
And
do,
that's how you do it.
Staying
Now,
alive.
if you
staying
notice
alive.
and you want to hear that click, if you hear my clicking,
Yes, I hear it on yours. I don't hear
Okay.
it on mine. What does that mean? Harder?
what that clicking means is that we have to go at a rate of 100 to 120 compressions.
Okay.
Okay, or thereabouts.
So that means I
And
need to
you
go
also
faster?
have to go about approximately 2 inches deep.
2 inches deep.
Yes.
So-
So if you think about it, when we're doing that and you come up here and you're pushing in right about here.
Okay.
When you push in, that hurts. By going in 2 inches
Yeah.
and hearing that clicking, you are actually going to break ribs.
So we don't want to do it too hard.
You do want to do it too
do
hard.
want
But what if we break a rib?
It won't.
They won't.
You got to
That's-
remember, you're doing this for a reason.
Right.
And ultimately, the reason is because the person's deceased. You can't hurt them.
Okay.
They don't feel it. They don't
feel
know it.
So tell me, here you have a click because the machine gives you a click.
Yes.
How do you know what the person? What are we going to feel?
You will feel it. You are going to feel all of a sudden a crack. It's almost like a crunch. But the good part is, if you want to call it that, it's only your first 3 or 4 pushes
that you'll hear that.
that you'll hear
So
it
you don't
and feel
panic.
it.
You just keep
Don't
doing
panic.
it.
You really can't hurt an individual in cardiac arrest by doing CPR on them any worse than they already are. Because,
That's
as Roger
important
said,
to remember.
they're clinically deceased.
Right.
Okay.
You're trying to save their life, and the most important thing you can do for them are effective compressions.
Okay, so shall we show everybody again?
Certainly.
So we go right under here.
So first things first, let's check to see if they're responsive.
So we look to check their
First,
airway.
we would check to see if they're.
Oh, forgive
Yep,
me. You're
that's
absolutely
okay.
right.
So we tap them on the shoulders,
Yep,
and then
and
you
then we
could
go
use,
like this.
Yep, rub them on their chest. If they don't respond,
Right?
then we would call 911.
Call
We
911
have friends here,
first.
so call 911.
You want to get
and
us
we'll
going
get
as
an
soon as you
AED.
can.
Call 911.
And then you want to see if they're breathing. So you
Right.
just take your hand, and you can, we'll move this one down a little bit so you're on the table.
Yep.
And then you just put your
And you
hand
got to put
over,
it right on the chest.
and then hand right on the chest.
Okay.
This way here, you're going to feel if the breath comes out,
Okay.
and you'll know if the chest rises.
And a good thing for everybody to remember before they even do this is take a nice deep breath, breathing in peace, breathing on calm. Get yourself
Yes.
centered. Don't panic, because the only way that you can really help them is to be calm.
Yes.
You do have to be ready to do CPR, and you do need to be calm
Have to
to
be
do that.
calm
Yes.
and focused.
One of the things I do say in all of my CPR classes when I teach
Yeah.
is I try to tell people right up front is if you are doing CPR on somebody, so you're doing compressions, you have to remember you're doing CPR because they're dead. They
Right.
don't have a pulse and they're not breathing.
Yes.
You can't make them deader, only better.
My goodness. Okay. That's
So,
an important thing to remember.
That's what we do.
So we check the airway.
Check.
We check this, but the other thing that we have to remember to do is that if they're on a bed, we need to move them off the bed and put them on a hard surface. If they're in
Yes.
a couch, we need to move them off the couch and put them on a hard
Correct.
You
surface.
want them on the floor or outside on the ground.
So what we would be doing, though, is checking first wherever they are to feel the breath and to feel if
Feel
their
their
heart,
heart.
and to
Yep.
check to see if they're responsive.
Yes.
Okay, so now we've
They're
got them on the
not-
floor.
And they're not responsive.
Right.
So what we do is we come up, we make that point.
Yes. which
And
is
the
right
two
there.
fingers
Two
above.
fingers. Yep.
And then you use the palm of your hand,
Palm of my hand.
middle fingers at the nipple line.
Right there.
Yep. And then you do your compressions.
It's going to be a lot easier for you when you're on the ground anyways, because you'll get that leverage. You'll be able to square off with your patient.
Staying alive, staying alive. Am I doing it fast enough?
You are. This is the way you do it.
So that's good. Do, staying alive,
Yes.
staying alive. By
And you
singing actually
continue
gives you
that-
energy to keep going.
Well, it does, but then
Yes, it gives
after
you rhythm.
It
Gives you the rhythm.
Gives you the rhythm.
It gives you a
Gives you the
rhythm.
rhythm.
It's we can't lie to you. It's going to. It's tiring.
How long does it take before somebody responds? When do you, if you have the energy to keep going, how long does it normally
Well,
take for the
honestly,
heart to respond?
this is a tool.
Okay.
This is the best tool that we have out there, short of the AED, which we're going to need to talk about here
Yes,
pretty
tell us
quickly.
about it.
The AED is a device that is housed in many areas throughout the city. You can find their locations by apps that are out there for the phone. And if you call 911, 911 has areas listed within the city so they can direct you to where the closest AED is.
But let me ask you something. How do you have time to do that? If you'd have to get somebody else to look for that while you're doing this and checking
is
this
true.
out,
So
correct?
this is why we're teaching the community, because we want everybody to get involved.
Okay.
It's not just one person, but it's hands of many make the load light. Well, that's what needs to happen here. While you start, hopefully you can get a hold of somebody
That can get this.
that can go get this.
What
for you.
happens? So you're doing this, and now you arrive with this. What do we do with it now?
Okay, so I'll let you go ahead.
Why don't we swap places?
Okay. So you're gonna do the compressions?
Yeah, I'll do the compressions for you.
So then what happens is he's doing compressions.
Yes.
Okay?
Yeah.
So then what I'm going to do is I arrive, I have the AED.
Okay.
So I pull up the AED, and the first thing you should always do once you have the AED is you want to turn it on.
Okay, and the AED stands for?
Automatic external defibrillator.
Okay, and that is to help get the
Restart
heart
the
going.
heart.
Yep.
Restarts the heart.
And
Okay.
you'll see these in airports and in public buildings. There's one right in the foyer of City Hall here in Nashua.
All right.
They're located in many, many
So
community
let's just stick
places.
this up so everybody can see this.
Yes.
And then what do we do with it now?
So what we do is he's doing compressions. we would hit the on button.
Do we plug anything in, or is it
We
all
will.
ready to go?
No, what we do on this one here, it depends on the AED machine.
Okay.
But all of them, the first thing you want to do is turn them on. On this
on.
particular one, we push the button.
Okay.
Some of them, you open them up. They're hard plastic, and once you open up the handles, they automatically turn on.
And they all generally have really clear, simple instructions.
Okay, good.
Yes.
All right then.
And the reason why we turn it on is to make sure that we have batteries and that it's going to work. Okay?
very good.
So on this one, we would turn it on,
Wait, it makes that
and
noise.
then we place the pads. So you're just listening to the
It tells you
instructions.
exactly what to do.
Your pad goes here.
While he continues to
Yep.
do this,
Oh,
I'll move this down.
and then this pad's going to come here, and we would stick them on.
Okay.
Okay. So
you
we would
stick them
peel
on,
and stick.
You peel off.
Yep.
Okay.
Stick it like that.
And that is right
Okay.
under here.
Yeah, and there's
Right on the rib
on this
the
one, it's
left
well used,
side.
but there's a visual that shows you where to put
And
it.
that's why I pulled these out. Your AED pads generally look like this.
All right.
Okay?
Yes.
So they're very
Shows you
well
exactly
marked.
where to place
okay?
it.
Yes. The yellow one always comes up here.
Yep. And the other one is right over here. Right down there.
And then the red one comes over here. Okay? So that was analyzing. So stop
It's
CPR.
telling you not to touch the patient.
So we don't touch the patient because
Okay.
the machine analyzes what is going on with the
So they're
heart.
saying shot advice. What do we need to do?
It's charging.
It's charging. Everybody's
So
clear.
this does the shot.
Don't touch the patient.
So we
Everybody's
step
clear.
back.
You step back.
All right, we're going to shock. Everyone clear? Continue CPR.
Begin CPR.
And if you notice, this is beeping and it's timing you. So you do your compressions.
Okay.
Okay. And this would stay on for 2 minutes. So you would do compressions for 2 minutes.
And then it tells you
It
when
will
it's going to
tell
give
you-
another shot, if it's
Yep.
needed or not.
Then it'll analyze again, yep.
Yes.
But see, that's the staying alive rhythm.
Yes.
That's the beat we want for the
Okay.
compressions.
All right.
And
Wow.
then that's what we do.
And that's what you do. And then you're doing this while you're waiting for you all to arrive.
Yes.
Okay, and so in a local place, you'll find these machines
will.
where?
You will find them on
they
the
near
wall.
fire
Usually
extinguishers,
they're
or-
very visible. Usually there's a sticker on the door at the main entryway of churches, of schools, sporting venues, those types of things.
Main entryway.
Yeah,
So that's
and,
important to know.
It could be up on the wall. It could be on the door. You could ask someone from the facility, "Do you have an AED?"
ED.
AED.
AED.
And they'll go and get it for you. Or as Karen said, you can call 911, and they generally know the location of the nearest AED. That's
In the building
where
that
you
you
are
are when you're
Yeah.
telling them.
Or in the vicinity.
So anybody who's doing this could actually work as a team if they have somebody else
Absolutely.
there. Immediately call 911, then immediately assess the situation while
Yep.
they're doing that. You're going to check the breath. You're
Yep.
going to check the heart rate. But
Yes.
first, before you do that, you're going to just to see if
Check
the
for
person
responsiveness, yeah.
responds and then bring them down to the floor while somebody's calling 911, and then after they call 911 to locate this machine.
The AED, yes.
Yep.
Okay? And then until that machine comes, you just continue to do.
Continue doing compressions.
And in that compression, what we do is we find this area here, right under here. We go 2 fingers up.
Yep.
We place our palm of
Palm
our
of your
hand
hand,
right
yep.
down, put our middle finger towards the nipple,
Nipple line.
raise
Yep.
up if we have to,
We lock our elbows.
lock our elbows, and then press.
Put your other hand right on top. There
Right,
you go. You
like
got
that. Sorry. So that's a do.
And don't be afraid. Give it a good push. 2 inches down.
Do.
There you go.
There you go.
Alive,
Better.
Staying alive.
And it will obviously be a lot easier when you're over the patient
Yes.
who's on the floor.
What
when you're
happens
on
is
the
you're
floor,
on
you're
the
then on
floor.
your knees.
You're on your knees.
And you have
what
more
happens
pressure
is
You have a
coming
lot.
down.
You're
Yes.
going to be
Yeah.
leaning over
because
with your
your
shoulders.
elbows are locked in place,
Okay.
and your shoulders should be lined up so that it's over the sternum. And then when you're doing your compressions, you're not going like this. It's your whole upper body
So
is
you're
pushing
using
down.
your weight and your
Yes.
whole thing to
Which
go
makes
into
it easier.
Okay.
Makes it easier to get that rhythm in set.
And-
Plus, you get your 2 inches, your depth in there.
And not
Much
as
easier.
exhausting.
Yes.
And you do it for as long as you can until help arrives.
Correct.
But you did say something important. If you get tired,
Then you get tired.
you just take a
You have
rest
to
and then
think
you
about
try to go
yourself
back and
as
do
well.
it again.
You
What
can.
was that?
You have to think of yourself as well.
Right.
If you
Take a
physically
break.
can't do it, you can take a break
Okay.
and start again when
Okay.
you get your wind back.
And I think it would be really important for people to know you are literally trying to help somebody who is already dead.
Yes.
And so that anything that you're doing is going to help them get better, hopefully,
Yes.
in a better situation. But I think it's also important for people to know that if for some reason the person doesn't come back and you've done everything that you possibly
Right.
can so that you don't feel guilty
Right.
related
You're
to
at
that.
peace
Because
with
you're
yourself.
at peace with
Yep.
yourself that you
Done the
try
best
to
you
do
can.
the best that you can.
There are good Samaritan laws in all states. So
Are
that
people protected?
They are, yes.
So they won't in any way get sued?
No.
No.
So they'll be okay, because people are worried about that.
Yeah.
Do
They
I
are,
intervene
and in
and
this
do
day and age,
something?
it happens.
Yeah.
But
It does happen.
um,
Every state has a Good Samaritan?
Yes, that I'm aware of. Yep, and it's very uncommon that somebody would come back and say, you didn't do the best you could. Most people do the best they can. You're trying to save a life.
Absolutely.
And everybody has a loved one that if that happened to them, you certainly would want someone to respond and
Yes.
try to save their life for them.
But actually, what we just did can help so many people that are viewing this learn exactly
Yes.
what to do so they could immediately do this, which is just fantastic.
It's very simple.
So if people wanted to learn more about this or to take a class, how would they do it?
Well, here in Nashua, we're happy to come out and do this for you. You can go to our website.
What is that, please?
It's amr.net, and there's links on there that get you right to your local
In any
AMR
state in the United
AMR state.
States.
Or you can stop at our station. You can catch us on the road. You
Okay.
can, whatever you want to do. We're happy to come out and do presentations for you
Wonderful.
and guide you through the process.
And people can watch this over and over again to help them to know how to do it. Now, when you're practicing, though, and learning how to do it, it's best to do it with a dummy, correct?
Yes, and if don't
You
do
don't
it
wanna
on a real person.
This is what I want to make sure.
yeah,
And
don't
you
want to do that.
You don't need the traditional valid CPR card that many people had in days of past. If you're a layperson, if you're just a non-healthcare provider,
Yes.
you don't need a card at all.
You don't.
Nope.
So as long as you learn it, you don't need to go through a certification training program in order to do this.
Right.
So for them to practice, what would they do, on a pillow?
You could.
You could
Yeah,
practice
certainly.
on a pillow. That would
Big
be
old
good.
teddy bear.
Yeah.
Yeah.
A teddy bear,
Sure.
a pillow,
Yeah.
so that would be
Yeah.
a great way so that if in fact anything happened, you at least would practice and know how to do that.
Yes.
Yes.
We
Okay.
do events at malls, all sorts of different places, and we try to advertise them as best we can so that people are aware ahead of time.
Okay.
We're going to be there and they can come.
And they can go to, what is it, online?
It's amr.net, and we're happy to link you right to our site or our Facebook site, and you can respond to us that way and ask us to come out and do a class.
And in any state, they can do the same thing, no matter where they're listening to this. They go on to amr.net and they can click to the state that
That's
they're
right.
in and go through this training. Is there a telephone number that anyone could call if they wanted more information?
The best way to do it is online
Okay.
through our website, and
Very good.
that'll link you right to it.
And of course, to remember that if anybody is going through this, one of the first things that you do is call 911.
Yes.
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 We thank you very much for this presentation, and we encourage everybody to learn this skill. Thank you very much. Until next time.